Okay, which of the following is the most likely cause of the findings? And looking at our answer choices, this is going to be a biochem, probably some kind of storage, like a lysosomal or type storage disease. So we've got a 3-year-old girl brought to the pediatrician by parents who report that she has had recurrent respiratory infections, slow development of motor skills. On physical exam, her abdomen is distended, and we do have hepatosplenomegaly. Lab tests show serum levels of lysosomal enzymes markedly elevated, so it is going to be one of her lysosomal storage diseases. Electron microscopy of skin biopsy reveals inclusions within fibroblasts. Okay, so the recurrent respiratory, slow motor skills, hepatosplenomegaly. Hepatosplenomegaly is going to be one of your more specific things. Okay. So I believe hepatosplenomegaly you see in Gaucher, but not Fabry. And Gaucher is also your most common. So that's kind of where I'm leaning. That would be galactocerebrosidase. Because alpha-1, that's going to be Hurler. It doesn't really look like Hurler. You usually would see like coarse species as well. Yeah, I think that's where I'm going to stick with.
Okay, so this one's actually a little bit different. This is actually eye cell disease.
Okay. I can never remember eye cell.
Yeah, so eye cell disease is kind of interesting in particular, right? The reason why it's eye cell is that there's all these lysosomal enzymes that are markedly elevated. There's a ton of them, all right? And then also on top of that, right? This I don't remember, right? But inclusions in the fibroblasts, apparently that's very specific for eye cell. But just kind of remember anytime they mention particularly that it's a lot of these lysosomal enzymes, that just means that instead of the correct targeting, right? What I mean by targeting is you're making these proteins or these enzymes that are supposed to be shipped into the lysosomes, which are intracellular, but instead you're accidentally shooting it out into the bloodstream. So they like asking about eye cell disease quite a bit. And the mono-6 phosphate receptor deficiency, this is the tag that allows it to be shipped. I can't remember if it's from the Golgi or from the ER into the lysosome. Does that make sense? Without this tag, it just gets shipped extracellularly, which is not good for our body. Who knows, right? Because remember, what does a lysosome do, right?
So lysosomes work kind of like a trash bag, like you're collecting your trash and taking it out of the cell.
Yeah, so and it breaks stuff down, right? And so imagine if you have these enzymes that are not isolated from the rest of your body, it's going to wreak a lot of havoc. So, but yeah, I would say that a lot of memorization, of course, right? At one point I had these down stone cold, and that was, I don't know, like maybe like 7, 8 years ago or something, right? But definitely for sure, I've forgotten a lot of the memorization portion of this. But one of the things that I kind of strongly recommend you to do is kind of look at the main features of some of these things, because once you do, it's hard to forget the clinical sign. I can help you get there on a clinical basis, like, oh yeah, that's Hurler's, right? Because you have such a weird coarse face, they'll always use that because it's so specific to Hurler's. But if you're telling me, how do I remember the the enzymes that are deficient? Yeah, I'm sorry. That's just you just got to sit with it, so.
Yeah, no, that makes sense.